Sometimes it's valuable to have someone help you manage a serious illness. That's where a patient navigator comes in. We continue to follow Scott Moore and meet his guide.
Ascending colon. So yours was
Well, it was in
removed.
this, what did you call it, the sigmoid? Is that what you called
The
that?
sigmoid's here.
There was there, and at the other end, that was the situation I had, is they were at extreme ends. So,
And that was the problem for you.
Scott Moore is a cyclist. At 53, he was in great shape until things changed.
January 5th, I had a symptom, and I acted on it the next day. And from that point, we got scheduled a appointment with the general surgeon. He set up my colonoscopy, and a couple of days after that, and then 2 days later, I was given the diagnosis of the results of the colonoscopy. So it started in mid-January. I was operated on Valentine's Day, February 14th of last year. Had a major operation. It's called a total colectomy, and that is where they have to remove the colon because I had it in two different areas.
In the midst of the medical turmoil, he was given a name.
And we're talking about Norton Navigator, Karen Allen, and I don't know how we got her name and how she came to us, but I remember probably a few days before my surgery, my wife talking to her on the phone, and we had somebody that would listen, and most people listen, but everybody's hurried and such, but she talked to her for over an hour probably and answered a lot of questions and took the level of anxiety down for us.
As a patient navigator, I connect with patients from the point of suspicious finding and carry them through all the way to survivorship.
We had somebody, and she would periodically check in with us, or if we had questions, and we were always welcome to get with her. And she helps guide you through the process. And I wonder sometimes where I would have wound up with a decision had I not, leaned on her a little bit. And she helped me along the way. I had some things that I needed to talk to her about. She either had the answers or would put you in touch with somebody. And that's important. You really need somebody who shows you a little compassion, and most people do, but it's such a process.
The common concerns and questions from patients are usually, one is very serious, and that is, am I going to die? Is this a terminal effect for me? Is this going to affect my whole family? Some of the answers are yes. This will affect not only you as a patient, but your entire family, and it will ripple out to your network. Not a person that you come in contact with will be unchanged by this, so we want to make sure that you're empowered, that you have knowledge about what's going on with you, and that you have a sense of control over your life. Some of the other common questions would be, how am I going to pay for this? We can sometimes connect them with financial resources. How am I going to be affected in my work life? Will I be able to continue to work? Will I be able to continue to take care of my children, my aged parents? And those sorts of questions. So any kind of question that would affect your daily life, that's even more significant if you have a diagnosis of cancer.
Scott's recovery has allowed him to meet his goals.
My first goal was just to walk around the house inside. Then I got up and down the drive, and then down the subdivision street and back. I always liked to bike before, cycling, so within about 3 months I was back on a bike, and I just took off.
He credits much of his success to his patient navigator, Karen Allen.
Sure. There again, I don't know how things would have turned out for me without her, because she had helped me make some decisions that I needed to make, and just their guidance, the resources.
The resources that can put you back on the path of better health. Better health starts with good food. A quick and healthy wrap from our chef Jeff when we come back.